About a month after the federal government told states and hospitals to change how they report coronavirus data.
Is it helping?
It's definitely not helping.
Delays at the Department of Health and Human Services are keeping the public, even local governments, from a timely view of vital statistics.
Most people have no faith in any of the data right now just because we know that some of it is less reliable.
Hospitalization data sometimes lags by days, and aggregate data is only updated once a week. Compare that to the 3 weekly updates with the previous system under the CDC. The Trump administration told states in mid-July to bypass the CDC. It's a move the CDC director says happened without his input.
Dr. Redfield, when did you first learn? When were you first told? When were you first notified?
Again, as I mentioned, I wasn't involved in the decision.
Though he says he agreed with the decision. Now, in a letter the New York Times obtained, 34 current and former members of a government health advisory committee say they're extremely concerned about the change, saying as each hospital or state recreates its COVID-19 reporting structure, the data's precision is at risk. Take Arizona, for instance. On August 11th, the state reported around 1,400 inpatient beds were occupied by coronavirus patients. The same day, HHS reported over 2,300 beds had COVID patients in the state. That's a number Arizona hasn't actually seen since late July.
We've been relying on a consistent, if imperfect, set of data. Now we may be getting better data, but it's inconsistent and less reliable because we don't know enough about it.
Should there be a more uniform mandated reporting process across all 50 states?
Oh my God, yes. I mean, this is the key step that we're missing right now.
Delays and inconsistency are just the start of the concerns. California says it fixed a technical glitch that prompted inaccurate data in its system.
It also prevented counties from having some of the data they need to monitor and respond to the virus in their communities.
And that's the danger.
It's like flying an airplane in the fog and your instrument panels are telling you what happened 10 minutes ago.
James Packard, Newsy, Chicago.